Dr. Sam Robson, Medical Director of Temple Clinic. The Temple V Weight Management and Lifestyle Programme focuses on losing weight and adopting strategies that can help to ensure that weight loss can be kept off for life. This brief webinar is the second in a series looking at the importance of sleep in weight management. This webinar looks at how we can improve the quality of our sleep. Having established the impact of sleep deprivation in the first webinar, we can clearly see that we should focus on addressing this. Fortunately, there are many effective strategies to improving the quality and quantity of your sleep. Sleeping pills are often prescribed, but are not a recommended solution. They promote sedation rather than sleep, and it's relatively easy to become dependent on them with no real benefit on sleep quality. Natural remedies, including herbal remedies, can help, but only valerian and kava have been shown to help people fall asleep and promote deeper sleep. So what about the non-drug options? These can be much more effective and just take practice and perseverance. There are two main categories: sleep conditioning and sleep hygiene. Firstly, let's consider sleep conditioning. This sets the scene for sleep and uses cognitive behavioural techniques. These include only going to bed when you are sleepy, only using the bed for sleep and for sex, so no reading, eating or screen time, and if you don't fall asleep within 20 minutes, then go to another room and do something relaxing, like a jigsaw, or read a book until you feel sleepy again. And finally, establish a strict routine, which means getting up at the same time, no matter how little sleep you've had. This conditions the brain to associate bed with sleep. Now let's consider sleep hygiene. Firstly, we should exercise regularly. This doesn't improve the quantity of sleep, but does impact on the quality of sleep, and it's thought to be better to exercise about 4 to 8 hours before bedtime. Caffeine, alcohol and nicotine should be avoided before bedtime. Although alcohol is a sedative, sedation is not sleep. And time-wise, it's advised to stop drinking coffee after about 1 p.m. and alcohol after 6 p.m. Relying on alcohol to help you sleep and coffee to waken you up can lead to a vicious circle of sedation and stimulation, which is bad for both sleep quality and wakefulness. In order to fall asleep, the core body temperature needs to drop by 1 to 2 degrees centigrade, so the ideal ambient temperature is 18.5 degrees centigrade. Having a hot bath not only helps you to wind down, but also warms the skin. This allows the body to rapidly cool when getting out of the bath, and this accentuates the nighttime drop that we need to be able to fall asleep quickly. Finally, keeping the bedroom as dark as possible, perhaps putting up blackout blinds or curtains, and investing in some comfortable earplugs can help you drop off to sleep. There are a few other tips and tricks that can help to improve the quality of your sleep. Remember that one of the important systems that controls sleep is light exposure. This affects production of melatonin, the sleep hormone. Bright light, especially at the blue end of the spectrum, inhibits melatonin production. Use table lamps with warm toned bulbs rather than harsher overhead light, and avoid or cut back on exposure to the blue light which can emanate from electronic devices such as phones, iPads or computers in the 2 hours before bed. Also, a dim red light at night in the hour before bedtime can minimize any interference with the production of melatonin. Exposure to bright daylight, especially in the morning, can actually help counter effects of light in the evening, perhaps going for a walk at lunchtime, walking or cycling to work, or sitting by the window during the day. Sunlight also promotes vitamin D production, which has been shown to improve sleep duration. Even using a natural daylight full spectrum lamp in the morning is of benefit if there is limited opportunity to be exposed to natural daylight. The final consideration is whether what we eat can improve our quality of sleep. Foods rich in melatonin can promote sleep when eaten in the evening. These include sour cherry juice, almonds, walnuts, banana, pineapple, kiwi fruit and oranges. Foods rich in tryptophan will increase serotonin production, which in turn promotes sleep. So cottage cheese, chicken, prawns and pumpkin seeds are good examples of this. And warm milk has been shown to have more of a psychological benefit, perhaps relating back to its association in getting babies and young children to sleep. But if you believe something will promote sleep, then it probably will. The placebo effect is a powerful thing. So in summary, there is no physical process that is not improved by sleep or impaired by the lack of it. Sleep deprivation will play havoc with our weight management and dieting efforts by affecting various hormones and brain biochemistry. Sleep habits can improve with sleep conditioning and sleep hygiene, so aiming for at least 7 hours per night. And attention to light exposure from both natural sources and electronic devices can impact on the sleep hormone melatonin. There are various foods and drinks that can enhance or inhibit sleep, but few medications that have a notable effect. So if on reflection you feel you're not getting the recommended amounts of sleep, then perhaps now is the time to make it a priority. Thank you for your time, and here's our contact details if you wish to contact us.